Hello, Palsy. Happy weekend. It's been a long week, but we made it, so happy weekend. And today, real quick, what I want to talk about is how to manage the pain medically. So for people that have been actually not diagnosed with Bell's palsy, but more with 𝙤𝙤𝙤𝙤 or with Ramsay-Hunt syndrome, which are generally much more painful than Bell's palsy. It's actually rare to have pain that lasts with Bell's palsy. Generally, the first few days before the onset can be painful, generally often with that pain behind the ear or some neck pain and tightness. But for once the diagnosis and once the symptoms of facial paralysis start, it's much more prevalent to have nerve pain and significant, quite severe at times pain when you have been diagnosed with Ramsay-Hunt syndrome or zoster. Of course, this should be prescribed by a physician. It's often the case that your diagnosis of Ramsay-Hunt of zoster is going to be not done in the ER. That tends to not be the case unless they do some specific test to rule that in. But it's likely going to be done by an otolaryngologist or maybe a neurologist. So that is something to make sure, especially if you start having pain as you're getting off your round of steroids and the antivirals, and the pain just keeps increasing and becomes more severe. Make sure you talk with your physician and discuss gabapentin. That is the medication to address nerve pain of choice in this situation. So I hope that was helpful. Have a great weekend, and I will catch with you later. Bye.